Alright, Diego Lopez. What I'm reviewing today is the topic was euthanasia. And first of all, to start off, her claim was the advocate's claim was very broad and vague, which is euthanasia alleviates pain and suffering. There was nothing really specific considering euthanasia, like whether it should be legal or something. And for those who do not understand what euthanasia is, in simple terms, it is known as assisted suicide to one who wants to relieve constant and unstoppable pain and suffering. Continuing on this broad claim, jumped all the way to her conclusion, and in her last words, she says that I'm not here to argue that euthanasia gives death with honor, but I am here to show you that euthanasia alleviates pain and suffering and is needed by many in the U.S. as an option for that very same reason. So in her last sentence, she's actually providing a whole different claim about euthanasia, saying that it needs to be an option for the U.S. rather than stating that in her main claim. And this is actually will become a claim of policy, saying that euthanasia should be an option for people in the U.S. So the stress here was that it was very unclear, and then she jumped into another claim which was not her main claim in the beginning. So going back to the beginning of our argument, right after her claim and definition of euthanasia, she gave the statistic that 25% of the people in the U.S. live with chronic pain. In her secondary claim that people in the U.S. live with pain. It is unclear to which she is suggesting that 25% should use euthanasia in order to relieve their pain, and if she is suggesting this, she's suggesting that 78 million people in the U.S. relieve their pain by assisted suicide, which is a very broad and bold statement. In the secondary claim that painkillers don't always work, she contradicts herself throughout the entire claim, as she's stating all the negative effects of painkillers, and in one sentence contradicts everything that she says by saying that prescription painkillers are effective treatments for chronic and persistent pain and can be taken safely. So she defeats her whole purpose, saying that painkillers aren't the way to go, that euthanasia, pro-euthanasia, but by saying that painkillers actually are useful and effective, defeats the whole purpose. Another contradictory example in that claim is that euthanasia is better than painkillers is when she stated the side effects of painkillers can be fatal. But the contradictory fact is that euthanasia is fatal, it's assisted suicide. So that didn't really make sense. And then she attempts to argue that painkillers are abused and that, quote, combining opiates with alcohol and some other drugs can also lead to severe reactions, all which seem hypothetical considering that not all patients overdose on painkillers, that it depends on the person if they overdose on the painkillers and if they are harmful to them. There's actually a statistic that 90.2% of painkillers are actually effective to people who use them. The whole argument was pretty short, and so in conclusion, the entire argument itself did not seem very clear, since I couldn't tell whether the claim was to legalize euthanasia throughout the U.S. or euthanasia was better than painkillers and medications, which leads me to conclude that it was very unclear in her position and the argument taken on euthanasia. That's it.
Gesundheit. All right, I think, Diego, that you spent a lot of time talking about the ambiguity of the argument, and when you then give us the summary of the argument, which basically eliminated the ambiguity, I'm wondering what it was that you were uncertain about. That really seems to be what the claim really was. maybe it's a criticism of the speech, but I'm not exactly sure that it's something for you to refute at that particular point. I thought that that you spent a lot of time on that, and it didn't really get you very much. Now, the places where you did develop some things that were more practical, there's the argument about chronic pain and whether or not anything is effective in doing something about it. I thought that you made a good press here. Look, chronic pain is not really what we're talking about for euthanasia. Otherwise, we would have, like you said, 78 million people, suggesting that that's how they should handle their chronic pain. And I doubt very much that anybody thinks that that's a good idea. I thought the argument that there's inconsistency in the advocate's point because they say there are all these pain issues, and then they say, well, the pain relief actually works. I think that's a good point. Later on in your argument, towards the end, you've got a piece of evidence that suggests that more than 90% of the pain relievers that people take are effective at meeting those standards. So if people have chronic pain, but 90% of them can relieve that pain with simple pain relief, then it sounds to me like whether or not there's a need for euthanasia to deal with this chronic pain, I think that seems to be a vastly overstated argument. I think that's the way you want to put that particular point. I did like the fact that you pointed out some inconsistencies when you say, well, the side effects of some of these pain relievers are fatalities, and there's a very obvious answer there. And guess what? Euthanasia, the side effect of that is also death. So this seems to be, death is pretty much the outcome for a lot of these folks, one way or the other. Why is it better that they have euthanasia? What is the advantage of that, especially if the painkillers are effective? I think that's the way you want to summarize that argument. All right, thank you all for your patience this evening. Christina, we'll hear you on Thursday. Sorry we didn't get a chance to get to you tonight.